that is Dr. DEEKSHA Garg, and she is the assistant professor come head of the department in the surgery, and she has 7 years of experience in teaching profession. She is doing lot of homeopathic, lot of work for homeopathic, as well as to make the students in a better quality products in the later part of their life, and so giving her determination to bring all of them the best doctors in the future, and they will definitely win the heart of the patients. So Dr. DEEKSHA Garg has completed her MD and now doing a lot of work. She has done so many presentation nationally as well as internationally, and she has presented so some public awareness classes, and she, after holding BHMS, she completed her MD from Guru Haraspur, and she has completed practical training course in acupressure and magnetic therapy from National Institute of Acupressure Research and Training Treatment in 2010. In addition to this, she has a master's degree in hospital administration from Academy of Hospital Administration, Noida, in 2021. DEEKSHA Garg has participated in various workshop seminars related to homeopathy, such as state-level workshop homeopathy and healthy mother, happy child project organized by Department of Ayush and NRHM in March 2010 at Chandigarh. There are so many things I would like to mention here, but all those things are there in the poster, and since she is waiting for a big presentation, as you all know, today we are about to discuss about the role of homeopathy in renal stone. As you all know, every homeopath get at least 1 to 5 cases in a week about this particular disease, and this is the thing usually troubles most of the peoples, and usually they go to the nephrologist and or urologist to find solution, but they may do some other way work, but still the patient is getting the same thing repeatedly. So they may search for some other solution. At last, they end up at the homeopathy clinic, and here we can deliver lot of wonders with our tools, because there is no medicine, no external surgery, but all the surgery for the renal calculus being done by our medicine. So let us welcome on this wonderful evening, Dr. Professor DEEKSHA Garg to this session. Welcome, Doctor.
Thank you, Dr. Danish. Thank you so much. Thank you for such a huge introduction. But words should speak. It should not be that introduction should speak. It should be that my work should speak. But thank you so much. Yes, today's topic is very commonly known, but where there are cases in the clinic where we get stuck. So we should discuss on this major high platform regarding this topic, so that with the problems we all are facing, that should be sorted. And it's just that it is our major point that being in the department of surgery, I need that everyone should be aware regarding the cases of renal calculi. Right? First, I would like to share my screen. Just make it clear. Am I correctly audible and visible?
Please share once. You
Yeah.
haven't put it shared.
Yeah.
Please share. Yes. Role of homeopathy in renal stone.
Right. Is
You
it
can see.
visible? Right.
Now you can put it in slide show.
Clear? Clear? It is clear?
Yes, it is clear, but
Right.
better to put it in a slideshow so that you can.
Yeah, it's in slideshow.
Okay.
Right. So let's start the today's topic, that is role of homeopathy in renal stones. Right. Let's see what are our objectives we should go through before starting the detail. First thing is that first we will learn about the basic introduction of the topic, that how the renal stones form and what is the incidence in worldwide and in India also. and how the formation of stone occur, what are the different types of stones, what is the clinical manifestations, what are the risk factors, most important part, what are the risk factors and what are the causes of renal stones, pathophysiology of stone formation, and finally the most important part, that is the treatment and prevention. Not only this, we will also discuss about the stones in the kidney that move to the ureter or move to the bladder and even to the urethra, how they causes the trouble and how we can treat these cases also. Let's look for next slide. Start with the introduction. Kidney stones. The other word for the kidney stones used is the renal calculus or the nephrolith. Lith means the stone. Lith means when there is a nucleus, and around the nucleus when there is a collection of mineral lead to the formation of some hard material that get deposits in the kidney, that is known as nephrolith. That is small hard deposits of the mineral and acid salt on the inner surface of the kidney. The stone grows to the sufficient size that even it can block to the ureter. There are specific areas where the ureter can be blocked. We will discuss about that also, where the stone can be stuck in the ureter. Usually in the kidneys, we can see the calcium stones. Maximum stones, 80% stones in the kidneys are the calcium stones. Like the same way we have the stones in the gallbladder and the intestine. But the today's topic is regarding the kidney. This is just I have mentioned to clear it that kidney stones are of multiple types, that the most common is the calcium stones. The stones usually form in the kidney, move to the ureter and may present in the bladder, but there are chances that even the stone can form in the bladder also, right? Incidence. When we see the picture depicting that 1 out of every 11 American will experience a kidney stone during their lifetime. This is not the American incidence. This is also happening in with this us Indians also. Urinary calculi are more common in men as per the study than in women. Incidence of the urinary calculi peaks between the third and fifth decade of the life. 80% of the stones are under 2 mm in size and they can easily pass out with the flush with the help of homeopathic medicines. 90% stones pass through the urinary system spontaneously, and there are seasonal variation with the stone. Which season causes it more? That is the summer season. Why the summer season? Because of dehydration. The more the dehydration, more the supersaturation, more the concentration, more the nucleus, more the formation of the stone will occur. This is the data I have taken from the National Institute of Diabetes and the Digestive and Kidney Diseases site, and it is the authentic data worldwide. Let's talk about the stone formation. When there is high concentration of urine, that constitutes the crystallization and formation of calculi, one of the major formation. Other thing is that when the kidney stones form, when a urine contains more crystals. One way it is that crystals are more in the urine, and other way that urine concentration is more. In the same way, when a urine may lack substance like that prevents these crystals sticking together. And last one is the when there is a deposition on the nucleus that continues to grow and that adheres to the renal papilla. Once it gets stuck to the renal papilla and keeps on crystallizing around the nucleus, it will lead to the stone formation that gets stuck into the kidney papillas, renal papillas, and leads to the different clinical manifestations. This picture. This picture is showing that as the stone become larger, it may become unattached. If we see in the right picture, there is a stone that is connected to the renal papilla. That is connected to the renal papilla. There are chances that it get bigger, bigger and bigger in the same area and didn't get detached. But there are chances when the part of a stone get detached and float into the large renal pelvis and comes down from the ureter comes down in the ureter, and in ureter it gets stuck in the different opening areas and lead to the blockage of ureter, and that is the time the patient feels the pain, and that is because of hydronephrosis. But it is not very clear why this detachment occur. When the stone gets larger, the area which is the weak crystallized will lead to the that breakage of the stone, and that stone comes to the ureter. But there are some cases where the stone doesn't get break off and it gets bigger in the same area, and it leads to the take up the complete shape of renal pelvis, and that is the stone known as staghorn stone. That stone is made up of calcium phosphate, takes up the complete area of the kidney and takes up the shape of renal pelvis, and that leads it to the atrophy of the kidney, and it is the most dangerous stone that leads to the damage of the kidney. Next slide comes the types of kidney stones. Theoretically, when we study, we have the 5 types of stones. First one is the calcium oxalate stones, that forms the maximum part that covers the maximum part of the kidney stones. That is the 80% stones are made up of calcium, which can be attached with the oxalate or which can be attached with phosphate. When it is the calcium oxalate stones, it is a mulberry stone, but when it is a calcium phosphate stone, it is a staghorn stone. The same stone I was talking about, that which get bigger and bigger in size and take up the area of the renal pelvis, and it becomes like a renal pelvis and leads to the atrophy of the kidney and finally the renal failure. Other than this, we have the basic stones. Next is the true white stone that usually occur in the infected urine. We will talk about it in later slides in detail. True white stones take up the 12% of all the kidney stones. Next is the uric acid stone, that is because of increased protein in the blood, and that leads to the increased uric acid, that covers the 7% of the kidney stones. And last is the cystine stones, that is only 1%, that is because of cystine in the blood. Let's talk about calcium stones. As we talk about that, calcium stones are of 2 types. One was the calcium oxalate stones and another is the calcium phosphate stones. Most kidney stones are calcium stones, usually in the form of calcium oxalate and the calcium phosphate. Oxalate is a naturally occurring substance found in food, as we all know. Very commonly, when the patient used to come to us, we used to ask patient not to eat brinjal, not to eat tomatoes, because they have the seeds. Those seeds are very rich in oxalate. If the patient has the recurrent tendency of renal calcium,
Madam, slides are not moving. Still, a role of homeopathy in renal stone, it is stuck.
I'm just moving. Next, come to the calcium stone.
No, it is not moving. I thought that.
Should I share again and stop sharing and then share again?
Yes, you may stop sharing and then restart. Go downwards.
Is it now calcium stone slide?
No, it is still stuck there. A role of homeopathy. You just PG down. Have to push, otherwise it may not be moving. Now it is introduction. Okay.
Right. That's why I'm thinking that I should share it like this. At least it will be shared with everyone.
Okay, that's enough. That's enough.
Right. So we talked about the introduction. Then we talked about the incidents. Then how the stone form. This was the slide I just want to show you, that how the stone form, how the nucleus is there, how the around the nucleus crystallization occur, and then it gets stuck to the renal papilla, and from there the one piece of the stone get break off and it comes in the ureter, and sometimes it didn't get break off and it gets stuck over there, take up the shape of the renal pelvis and become like a renal pelvis only, leads to the shrinkage of the papilla area, and that leads to the renal atrophy and finally the renal failure. Means a stone can be deadly also. It can lead to renal failure also. This is the picture where I am just showing that how the stone get break off. We cannot even read this thing actually, because if it's in a slideshow, you will be able to read it all. But you can see the stones, the different types of stones, the calcium stones, uric acid stones, true white stones, cystine stones. We talked about it. Yes, I was here. So next, the most common stones in the 80% cases are the calcium stones, and calcium stones get attached with the oxalate or the phosphate. The phosphate stones are the same staghorn stones that comes in the alkaline urine, enlarge rapidly, take up the shape of the calyces, and then lead to the shrinkage of the papilla and the atrophy of the kidney. Other is the oxalate stones. Oxalate is naturally present in our food, and that is present in some fruits and vegetables as well as in nuts and chocolates. And these high rich oxalate food leads to the high level of oxalate and finally leads to the calcium stone formation. Next is the uric acid stones, that is more common in men, and that is because of increased uric acid, and usually in the patient suffering from the gout and those who are going under chemotherapy. Next is this true white stone. This occurs in more common in women, and that is in the infected urine. The woman who is suffering from the urinary tract infection has more chances of stone, that is the true white stone, and that causes the urinary obstruction. Next, last is the cystine stones, and that is very rare, 1% cases, and this is the genetic disorder, that is cystinuria, where the men or women can have the cystine stones. Other than this, we have the xanthine stones and other types of stones too. I hope now slides are moving. We cannot discuss this slide. Actually, it is not visible. Let's leave this. Let's talk about the clinical manifestations. Very common. The picture in the right end is depicting the pain, the severe pain a renal calculi patient feels, that is from the loins to groins. The pain in the flanks that moves in the inner part of the thigh and the genitals depend upon the area of the stone. If stone is present in the kidney, it leads to the pain from the loins to groins. But if it moves to the ureter, it may lead to the pain in the inner part of the thigh and the genitals. The stone may lead to the abdominal pain, nausea, vomiting, fatigue. It may lead to the increased body temperature, blood pressure, and respiratory rate. There is a very steady pain and pain on urination. Urine is usually of different color, that is pink, red, or brown urine. And because of obstruction, there may be chances of oliguria and even the retention of urine. The term here mentioned is the anuria, which may be possible or may not be possible. We have three terms over here. That is, one is the oliguria, another is anuria, and third is the retention of urine. If stone is present in the bladder and it gets stuck to the mouth of urethra, that will lead to the retention of urine. Means urine will not come out of the urethra, but the formation of urine is normal. But if the stone is like a staghorn stone that takes up the area of the renal pelvis and it leads to the renal failure, so there is no formation of urine. If there is no formation of urine, it leads to the anuria. So anuria can happen, retention of urine can happen, and oliguria can happen. And our homeopathic medicine will vary as per the symptom. Patient having nausea, vomiting, having the different homeopathic medicine for renal calculi. Patient is having the pink urine, different medicine. Red urine, different medicine. Oliguria, different medicine. The same hematuria, that means RBCs are coming in the urine, we have different medicine. Renal colic, if there is continuation colicky pain, different medicine. And if there is the dilatation of the renal pelvis, that is hydronephrosis, we have a very good homeopathic medicines. Next comes the causes. When we talk about causes, very common causes, when we talk about in a layman language, what we have to guide our patient, that is the wrong diet. The diet is more rich in oxalate or more rich in the protein that leads to the uric acid stones or the oxalate stones. Drinking less water because that leads to dehydration. Laziness in passing urine because that leads to the back pressure of the urine. The less consumption of vitamin A and vitamin C, excess of hard work, and different urine disorders which they are ignoring. These all can lead to a trouble of renal calculi. But the other way where we have to consider the causes are the supersaturation of urine. One is that, other is the imbalance of pH. Yes, what is imbalance? One slide I have skipped. There I have mentioned these things which was not visible in this type. That is, if we talk about alkaline urine, so more of the calcium phosphate stones occur in the alkaline urine. When we talk about acidic urine, the more of the calcium oxalate stones occur in the acidic urine. So we should keep the balance of the pH in urine. The imbalance of pH may lead to the stone formation. Acidic urine can lead to calcium oxalate stone and alkaline urine can lead to the calcium phosphate stone. The third cause is the gout, because gout leads to the increase in uric acid levels, protein levels, and that protein will lead to the formation of stones. Next is the hyperparathyroidism. Yes, this is one of the major cause of the renal calculi. We should check the vitamin D levels, otherwise there is formation of stones may occur. The inflammatory bowel disease, that is a common cause. One is the urinary tract infection. We have already talked about it. That is the struvite stones are formed due to the urinary tract infection and it is more common in females. Dehydration, because that leads to supersaturation. And last is the crystal aggregation. The crystal aggregation around the nucleus and it gets stuck to the papilla and lead to the stone formation. Next comes the risk factors. The same way we talk about the cause, risk factors are the similar one: high mineral intake in drinking water, dehydration, the family or the personal history, dietary intake, and patient is obese. These all are the risk factor if they combine with the cause and leads to the renal stone formation. How this stone form? That is the saturation. When there is the slow urine flow, that leads to the saturation and finally leads to supersaturation. Slowly there is nucleation and around that nucleus there is the crystal growth and aggregation and finally the stone formation. Now it comes to the clinical part. When we talk about clinical part, what we need to ask the patient in the history. Patient comes to you with a clinical feature the same way that patient is having pain, nausea, vomiting, hematuria, or patient is having the crystals in the urine, or the patient is having dehydration or pain. Then what you will ask? What we will ask about is patient drinking enough water? What is the profession of the patient? Long standing and the long sitting jobs can even lead to the stone formation. Inquire about the urinary tract infection because that may lead to the stone formation. Is there any family history of the stone formation, or is there any bedridden patient? Because of the long illness, if patient is bedridden, even can lead to the stone formation. Once the history has been taken, we should investigate the case. How we will investigate? The most common investigation is the blood count. We'll check the blood count of the patient. If that patient is having hematuria, that may lead to the anemia. Next is the serum electrolytes: urea, creatinine, calcium, uric acid, phosphate, and bicarbonates to take up the content of the blood. Next is the 24 hours urine for electrolytes. We have to take the stone former. We have to check that stone is of calcium, oxalate, uric acid, cystine, or urates. That will be taken up in the 24 hours urine electrolytes. And These are the blood investigation or the urine investigation. Other than this, we have the scans. One is the plain KUB. KUB stands for kidney ureter bladder X-ray of the abdomen. That will show the stones. But it is not sufficient. Why it is not sufficient? Because we have the radio opaque and radiolucent stones, right? So if the stone is radio opaque, that is visible in the X-ray. Otherwise, the stone will not be visible. So uric acid stones are not visible in X-ray. So we prefer the ultrasound. If if ultrasound is not going with the stone, or we are not getting the proper reports, we go for the IVU, that is intravenous urogram. That is useful for the radiolucent stones and even can detect the congenital anomalies in the urinary tract. And to make the differential diagnosis with other diseases, we go for the CT scan in cases where there is doubt for any other disease condition. This is just a picture that I am showing the diagnostic criteria. It is not only the diagnostic study, it is the therapeutic process also in allopathy, or we say the surgery one. Because I am teaching the surgery, that's why I have mentioned this, that this is the cystoscopy. It's a process where we get the diagnosis through. One is another one is the intravenous urogram, or also called as the pyelogram, where we introduce the dye, inject the dye, and then take up the X-ray that will help us to diagnose the radiolucent stones. And this is the picture of general ultrasound, how we take up which area we consider for the renal calculi. Next comes the treatment part. Usually the treatment part, we take up the management. One is the management and other is the treatment. The management part is that the pain should be managed. Patient strain for the urine for the stone, patient should be asked to go for the urine repeatedly. Patient should be take up the water properly, keep hydrated. Patient should be ambulated, that is patient keep moving here and there, that will help. Diet should be restricted, emotional support should be given, and then if needed, then invasive procedures are to be done. This is very important. How we can prevent the reoccurrence? That is by keeping ourselves hydrated, by taking up the at least 3 to 4 liters of water, taking up the lemonades, and diet should be low in sodium and calcium. We should avoid intake of oxalate containing foods like spinach, strawberries, raspberries, and tea and peanuts, and even the wheat bran. Diet should also be low in protein as it leads to the uric acid stone. Proper exercise and activity will lead to the sudden increase. Any increase in the environmental temperature will lead to the sweating and dehydration. So exercise should be done, but in a proper way. I have added a slide on the home remedies also. That is like good coconut water is good. We should avoid eating meat. We should have the fresh ripe apple, melons, and grapes. We should avoid food with vitamin D. Why vitamin D? It leads to the hyperparathyroidism, and it is the one of the major leading cause of the renal stone formation, and the calcium intake also. Right. The same thing I was talking in the first slide, that the renal calculi is not only the thing, but once the stone get detached from the renal area, may move to the ureter, and it may lead to the ureteric calculi. And ureteric calculi is always more painful than the renal calculi. We know that ureteric calculi are originally they are from the renal area only, from the kidney. There is no formation of stone in the ureter, but the ureter is very thin, and the stone get impacted in the narrow junctions. Let's see what are the junctions where the stones can stuck. These are the impaction. The first part is the uretropelvic junction, the junction where the kidney ends and the ureter starts. There the stone can stuck. The second one is the crossing of the iliac artery, because the artery is creating pressure on the ureter. In that area, that stone gets stuck. Third is the where the ureter is entering the bladder. That is again a narrow junction. There the stone gets stuck. Once the stone gets stuck in any of these three places, the above part get dilated. If it gets stuck in the uretropelvic junction, the kidney pelvis will get dilated. If gets stuck in the crossing of the iliac artery, the above ureter will get dilated, and that dilated ureter will lead to the hydronephrosis. And sometimes these type of cases need the surgical interventions also. Not only this, we have to rule out the other diseases, other differential diseases from this. That is from the appendicitis, from cholecystitis, from ovarian cyst. We know that appendicitis do have the pain in the right renal, right, right, right iliac fossa. So it can be camouflaged like the pain of the renal calculi. So we should be rule out the appendicitis, the pain of the gallbladder stones, any ovarian cyst, any mesenteric adenitis, any ruptured ectopic gestation. If there is ectopic gestation that is in the fallopian tube which get ruptured, may lead to a severe pain like acute abdomen, which may look like the pain of a renal calculi, or any disease condition of the tube or ovary may look like a renal calculi, and that can only be ruled out with the help of ultrasound, which it can be ruled out with the help of x-ray, CT scan, and the intravenous urogram. Yes, this is the another slide. The stone can present in the kidney, it can be moved to the ureter, or it can move from the ureter to the bladder. Plus, there can be stone formation in the bladder also. Primarily, there is stone formation. Primarily, there is the stone that comes from the kidney that develops in the sterile urine. But there can be formation of stone in the bladder, that is in the infected urine, that leads to the outflow obstruction, impaired the bladder emptying, or there is foreign body sensation. That impaired bladder emptying is known as retention of urine. Because of that obstruction, there is a trigone in the bladder. If the stone comes in that trigone, it comes to the mouth of urethra, it leads to the obstruction of the mouth of urethra and finally leads to the retention of urine. These are very common homeopathic medicines that helps every homeopath in their clinic in treating the cases of renal calculi. That one is the most common is the Barbaris vulgaris, another is the hydrangea, another is the lycopodium, next is the sarsaparilla and the cantharis. Other than this, there are a lot of medicines, but I'm able to add few. Let's talk about few of remedies from this. Yes, Barbaris vulgaris is the left-sided remedy, and it is the top listed medicine for the kidney stones formed on the left side. All the features of this Barbaris vulgaris treat the patient if there is stone in the left kidney that radiates down to the ureter and even to the urinary bladder. That's why I have mentioned in my slides that we can treat the stones in the kidney, in the ureter, or in the bladder. If the stone from the left side moves to the ureter, leads to the hydronephrosis of left side, can help, Barbaris can help to treat the patient. Pain here is the shooting, stitching, cutting, or stinging in nature. Pain was by any kind of movement, especially the jarring movement. Urine may be yellow and may contain the slimy sediments. The area around the kidney is very sensitive to touch. Means the patient is having pain and even the tenderness and even the hypersensitivity also. This is the way we use. Every homeopath has their own opinion, but according to me, Barbaris vulgaris is used in the form of mother tincture in the renal stone, and it may also be used in the 30 potency. It should not be used without any advisory with the doctor. Yes, because there are many chemist shops in the market. They are just selling like Barbaris vulgaris, like a cough syrup. That the patient asks them that I'm having a renal stone, take it the Barbaris vulgaris, take it the Barbaris vulgaris. It should not be. It should be the specific. It should be always with the recommendation of the doctor. Next medicine is the lycopodium. Like the Barbaris vulgaris, lycopodium is the right-sided remedy and it is helps in the treating the kidney stones on right side. It is indicated where there is pain in the right kidney and in the right ureter. Now we get the left, we get the right. The pain gets worse before urination and there is a forceful straining and urine is scanty. Patient has the urgency of urine, but there is hesitancy of urine. These two words are very important here, that once the patient go to pass the urine, patient has to wait and the urine is very scanty. The kidney pain subsides after urination and the urine may contains the red sediments. Red sediments means the RBCs in the urine, and urine may contain pus cells also, that is turbid or pale in urine. Next is the hydrangea. Hydrangea for stones in kidney with white or yellow sand in urine. It is very popularly known as stone breaker. Yes, as Dr. Danish starts my introduction, and then he mentioned that we are the people where we do the surgery with the help of medicine only. This is the surgery with the medicine. Allopathic doctors used to ask that how you will remove a stone of 9 mm from a pipe of 4 mm. We have a ureter of 4 mm and we will remove a stone of 9 mm that moves from the kidney. Yes, this is our surgery. It will, the hydrangea and the barbaris combination breaks the stone and move the stone out of the kidney. This is the stone breaker medicine and it crush the kidney stones, bring the stones in the ureter, comes to the bladder and remove it. It has a wonderful results in the renal stones. It is the well indicated remedy where there is soreness in the kidney region and even the blood appear in the urine. Next comes the cantharis. We know that this remedy is meant for burning. If there is intense burning on passing urine, we give the cantharis. The burning sensation may also felt before urination that continues even after urination. Burning like hell is the word for the cantharis. Patient is having tenesmus of the bladder, which is marked where the urge to pass the urine is almost constant. There is unsatisfactory urination. Patient keeps on going for to pass the urine, but there is no satisfaction even after passing urine, plus burning sensation. And there is jelly-like mucus in the urine. Next comes the sarsaparilla. It is the medicine with burning at close of urination. This medicine is used where there is excessive burning. When we talk about cantharis, there is complete burning before, during, and after. But sarsaparilla is indicated where there is excessive burning at the closure of urination and patient passes scanty urine with slimy and sand-like particles. And it is well indicated remedy like lycopodium for the right side kidney stones. Other than these very common remedies, we have the argentum nitricum, that is again for the pain due to kidney congestion, that is nephralgia, and that is pain because of hydronephrosis. The pain is dull aching pain experienced in the back of the bladder and the urine is dark. Dark means there is blood present in the urine, and this remedy is very useful where there is uric acid stones. Urine passes little at a time, usually in the drops. It is the marked symptom here. The urine passes little at a time, usually in drops, and patient face become very dark and dry. Urine burns during passing, and urethra feels like it is swollen. That's why there is scanty urine. Next is the belladonna, the main remedy of our homeopathy, that it is for the pain, the kidney stones that lead to the sharp shooting pain and the sudden cramping and straining along the ureter during while passing the urine, and patient feel very feverish, very excited, irritable, and pain comes, goes again and again. Next remedy is the benzoic acid. Benzoic acid is a homeopathic medicine that is used in the cases of colic with offensive urine. One of the medicine where there is offensive urine, strong smell urine that is like a cadaver. It is a putrid, smelly, cadaverous urine. Urine is very thick, sometimes it is watery like clear, but it is very offensive, profuse, and thick. Next is the Pararia breva. Very clear remedy. It is for the where urine is passed with a lot of effort but in drops there is severe pain, kidney stone pain with strangury. Strangury is the painful urine in drops. When the patient comes to pass the urine, but there is spasm in the urethra, leads to the difficulty in passing urine. And when the patient passes the urine, it is just in drops. Very clear remedy, Artica urins. Name itself telling that it is the remedy for the uric acid high level. If there is high level of uric acid, we even give this remedy in the cases of gout, very effective remedy in the gout, and it helps to treat the patient whether the kidney stones due to high uric acid levels. Next remedy comes the osmum can. It is for the nausea and vomiting. I'm covering the every clinical manifestation. We talked about the pain, we talked about the color of the urine, we talked about the hematuria. Now I'm taking about the nausea and vomiting. Osmum can is the remedy for the kidney stones where there is pain accompanied by the vomiting. This remedy is immensely helpful for the kidney stone in cases where vomiting is typically observed along with the pain. It can help both right and left kidney stones, but if the discomfort is accompanied by vomiting, again and again I'm using the word vomiting, the patient is having the complaint of vomiting with the kidney stone, we use the remedy osmum can. Next remedy is the colocynth. Colocynth is the double bending. The word colocynth is the double bending, agonizing pain, where the patient bend double to relieve the pain is the colocynth. It is basically helps to relieve the pain when patient bends double. There is agonizing pain. Patient is having pain after eating and drinking, better by warm application and bending double, shooting pain like electric shock, and the complaints are accompanied by anger, indignation, and mortification. Next remedy is nux vomica. Nux vomica, the word for nux vomica, the three words. One is the right-sided remedy, second is the hematuria, third is the strangury. And the main thing we know that the one of the leading risk factor, that is the obese. The patient having the bad habits of coffee, tobacco, alcohol, high spiced food, overeating, long continued mental exertion, these all lead to stone formation, which usually occur in the right side, leads to the blood in the urine and even the difficulty to pass urine. We can use this remedy very well, that is nux vomica. Again, another remedy is the diascoria. Diascoria is the remedy where there is the radiating pain, radiating to the extremities. As I have talked that there are some patients which are having the pain even in the area of thigh. There we can use this remedy. This is a very powerful remedy where the pain suddenly shifts to different parts, to the remote area other than the defined area. Defined area is loins to groins to the thigh, even in the remote area, in the fingers and toes. If the patient is feeling pain with the renal calculi, we can use the remedy Dioscoria. Next is the solidago. Urine is scanty, reddish brown, thick sediments with dysuria. Dysuria is painful urination, pain in the kidney that extends to the bladder and the abdomen. Urine is difficult and scanty, and there is albumin in the urine, that is the protein, blood, and slime. Kidney is very sensitive to pressure, and backache may present with the kidney stone. These are the few remedies that are discussed regarding. We have lot of remedies. I've picked up something from the repertory, how we check the repertory. If I go for the pain extending bladder, we have marked remedies like berberis, cantharis, lycopodium, sarsaparilla, and solidago. That's why I have briefed that these are the main remedies: berberis, cantharis, lyco, and sarsaparilla, that we use in the cases of kidney stones. And not to forget that hydrangea. The same way, if we talk about nausea, pain with, we have the pararia in the list, right? The same way I have compared the two remedies, that is berberis and cantharis, which are covering all the symptoms, that is pain extending abdomen, the inguinal region, the back, the directions, all the genitalia, even the lower abdomen to the testicles, to the ureter. Everywhere in our repertory, we have the remedy berberis, cantharis, lycopodium, sarsaparilla, and the hydrangea. I hope I'm able to make all of you clear about the topic, as I've tried my best that we should get a sum up of the topic. Over to you, Dr. Danish. That's all from my side.
Thank you, Dr. DEEKSHA GARG. It's really a very good session. You covered almost all part of this renal calculus problem. And not only that, you have beautifully narrated the etiology as well as the diagnostic point of view, as well as the choosing the medicine. That means the differential diagnosis of each medicine. And of course, we, as you rightly pointed out, that there are situation where homeopathic doctors need to advise some patients for surgery. But before that, even we can manage with our medicine. We can, as you rightly pointed out, that we can drag the stone by means of our tools, that is our homeopathic medicine, potentized medicine, that will do wonders. And definitely, there are certain medicines also that will definitely give a very good relief to the patient. I still remember a case of sulfur. There was a patient who was having this renal calculus problem for about 6 years, and she could not even bend forward. She was working in a paddy field, but she could not do her daily duty on that way. But when I give some medicines as per the symptoms, it doesn't work properly. But once I got a clue from her, I just give her sulfur 0/3. And really, it was from the very next day itself, she started passing urine, and so not only passing stones regularly. It lasts for about 1 month. Believe it or not, there were 4 to 5 stones in their kidney, but we don't know how this much of stones came out from her kidney. That kind of situation the sulfur has done to me, and that patient is now able to work in the paddy field without any trouble. She can do it her daily business without any problem. And she never have these for the last 15 years. She never developed this renal stone again. That's the beauty of homeopathy.
Beauty,
And
right? Miraculous, right?
since time is short, otherwise, I think that you can bring some of your cases in the next edition of your presentation. So
Done.
that, we will, some of our doctors can also present some of their cases, so that this will become a very good thing for homeopathic lovers as well as homeopathic doctors. I invite all of you to participate in the discussion. Only short time is remaining. Dr. Ram Parais sir is there, so you can talk, sir, now.
Hanji sir.
Please unmute.
Dr. Ram, please unmute.
Yes. Please, once again, you are muted, sir.
Sir, he's
Please,
unmuting.
you are still muted, sir. Please unmute.
Yeah, it's now unmuted.
Hello.
Hello,
Yes.
sir. Hello.
Hello. Thank you, Dr. DEEKSHA Madam. Very
Thank you, sir.
nice
Thank you.
presentation. Excellent session.
Thank you, sir. Thank you
According
so
to
much.
role of homeopathic, which deals very cover rubric lycopodium, canthrid, berberis, hydrogenia. Actually, homeopathic kit the many kinds of remedy. His deals very nice. Excellent session. Thank you.
Thank you so much. Thank you so much, sir. Thank you.
Okay.
And